Studies show that British children consume 65% of their daily calorie intake as ultra-processed foods, the highest level in Europe. According to the NHS website, ultra-processed foods or UPFs are foods like sweetened drinks, crisps, packaged biscuits, and cakes, containing ingredients usually not found at home. The NOVA classification system identifies UPFs as industrially produced edible substance. UPFs are produced with ingredients such as additives like glucose syrup, emulsifiers, stabilizers, and preservatives. Common characteristics of UPFs are high palatability, such as making food texture and taste enjoyable. They also have attractive packaging, often marketed to young children, and misleading health claims on their products. Dr. Lauren Curtis White helps define ultra-processed foods.
Those foods that have gone through an extensive period of being broken down into its constituent parts and then rebuilt back up, and that processing can fundamentally change how the effect that those compounds have on your body. People don't agree on the health impact of processing.
The UK government's Eat Well guidance may consider some ultra-processed food as part of nutritional intake, such as wholemeal bread and baked beans considered to be affordable and healthy. However, UPFs have been associated with increased health risks found across many studies. Chloe, a primary school teacher, shares her experience.
I think quite a lot of the children are actually influenced by social media and the things they see on telly. For example, they're not allowed to bring like Prime energy drinks into school, but that's something that they all obsess over. They watch YouTube, they idolise YouTubers. So, seeing that there, they don't really see the bad in it. In school lunches, packed lunches specifically, you'll see a lot of the children with specific chocolate bars, or really big one at the moment is pepperami sticks.
Despite restrictions on advertising of foods high in fat, salt, and sugar, UPFs have been associated with increased health risks found across many studies, particularly among children who are most vulnerable to advertising.
It is well founded that there is a correlation between advertising with unhealthy food products and how much people eat, particularly children and young people. We know it increases the purchasing of those advertised or unhealthy products more generally. And then we know the likelihood is that people who are exposed to the advertising of those unhealthy food products are likely to purchase them again and again over time. And that is something that can be set in childhood, but it also can change over time as well.
Highly palatable foods have been linked to consuming foods beyond daily energy intakes, and a study shows children from lower income families have a higher consumption rate of UPFs.
From what I've seen in my class, the children that come from lower income families, you often see that they either have school dinner, or they'll have a lot of frozen pizzas or just like leftovers from the day before. They're not allowed to bring certain things into school. There's a limit to how much unhealthy things they can bring in, but there's not so much of a limit that it will ensure that they are eating healthily. A lot of it's financial, really, like the amount of money that it costs to buy such healthy foods.
But what policies can we implement to change this?
Based on the evidence, I would argue that at the moment we live in a world where we do not have free choice around the food that we consume. Marketing can cover advertising, it's lobbying that companies undertake, lots of different things. We are bombarded by marketing for high fat, sugar and salt or ultra processed foods, which then means our choice is already swayed towards the consumption of those products. So I think one of the things that I would bring in would be more stringent statutory regulations around the marketing of ultra processed foods. But another aspect to that, and probably should come first, is to restrict the involvement of ultra-processed companies in the policy-making process. They should not be part of the policy design, because you cannot bring in any strong regulations around ultra-processed foods if the ultra-processed food industry are involved in policy-making itself, because they will never bring in a policy that seeks to undermine their industry's profit-making abilities. The restriction of industry involvement in policy making, and then bringing in policies to reduce the marketing of those products to the public. Now, I'm not saying that government shouldn't speak to industry. Government should speak to industry, but that should be separate from any policy design process. And industry can be involved in discussions around, okay, well, how do you implement that policy effectively?